So leg screw, where to apply? Suppose femur and there is fracture of condyle. Suppose there is fracture and that fracture is oblique and you want leg screw. So the first step is oblique fracture. Then select the size. For example, 3.5 mm screw cortical. Okay. If we look at 5 mm screw, it is having two type of diameter. This outer, obviously it is 3.5 mm. This shaft diameter is 2.1. This one. So we know the condylar fracture. There is and we have selected this, that is 5 mm screw. Suppose it is a cortical screw and you want to apply. Okay. So for this there are two cortex. One is cis and one is trans. This is your oblique fracture. So we need to make two types of hole. One hole will be 3.5 mm diameter. Your screw is 3.5 mm diameter. And second, in the far cortex, this hole should be 2.7. This 7 mm. So two cortex are there. Two holes, one small. I will tell making of different sizes. This is known as gliding and this is known as thread hole. So, first step is over. We make gliding hole, thread hole. Okay. Then next step is, there is one instrument called countersink. What is the role of countersink? Suppose you are applying screw like this. Will sitting on of the bone, but we are using its head should go at the level of the bone. It should not be out. It should sit with parallel to. So counter means to a screw, head of the screw. Yeah. Second step. Third step is for tap. There is instrument called tap. Tap means thread, so that it will go inside the thread hole. So making thread where in thread hole which is 2.7 mm. If you are using self-taping screw, then this instrument is not required because the screw itself make the thread in this smaller hole. This next step will be apply your screw. So what we did, see, this was the yes, and this was the screw, 3 mm screw, having core diameter 2.5 mm. Suppose 2.5 mm. So put your screw here. This is head. It will glide. Size of this hole is 3.5. It can easily enter. Problem is here. We created 2.mm hole. So if the tip is cutting, if tip of the screw is cutting, it will cut threads in it, and that thread will suppose this is 2, that will be 8 mm and it will become 3.5. Hole is 3.5 mm hole. It is going easily inside this. So how to engage, how to fix here? It will cut and will sit in this. When it cuts the threads engaged here, then tightening the screw, it is keep on cutting the threads and it will engage to compression of the distal part to how it happens. This was the oblique thread. This was the big hole and this was the 3 mm gliding hole and this was the 2.7 mm thread hole. Screw will enter easily. It will glide here. No threading, no cutting. But here hole is less, so the screw will start and it will engage here. When you are tightening the screw and it engaged, it will move this fragment proximal one. So when you tighten, then what will happen? Distal fragment will move towards proximal, and this movement, this is compression. So leg screw is used for the compression. So where to use leg? See, these are the condyles. If you use leg screw here, this is oblique fracture. Animal's body weight is high. One screw alone is not enough. Bear this weight. So we cannot apply single leg screw or in the shaft. So you can apply your screw. The direct load of the body is not there. So side we have condyle or epicondyle. If they are fractured, apply your legs like this. You can apply. Of greater trochanter, you can apply. So at those places where load is not there, you can apply. So for mid shaft, you can screw along with the plate. along with the bone plate. That, but alone a single screw will not help you. It can small fragment, oblique fractures, like condylar fracture, like trochanter. Suppose there is fracture of neck of the femur, then also for oblique fracture we can apply leg screw. So what we used and from the help of drill bit we created these two holes. Hole one small. Number three was here threads are here created only in cortex, only in transcortex. What will happen if we make, suppose this is oblique fracture, if we holes of equal size, equal 3 point, if I make 3.5 mm this, 3.5 mm, answer is nothing will happen. Answer is no compression. Answer is no compression. Then only anatomical alignment will be there. Only anatomical alignment will be there. If there is fracture, suppose this, and this is the fracture like this. Slip, what is principle? Compression. Yes, it will move towards still fragment. It will, but pressure in that situation. Proper position, alignment, just to hold. That is known as position screw. Leg screw and screw. Gliding hole less diameter. Suppose hole in the transcortex. Hole. What is anatomical When it will occur? When compression will occur. Screw fragment will and fragment will be compressed. If you use equal size hole, no compression. There will be no compression. That will be called position screw. Next, this is your femur. You want to apply one plate.
Hello.
Apply two plate screw just first is fill the hole and last is in